budget meeting of the Santa Barbara County Board of Supervisors to order. It's Wednesday, June 13th, 2012. Mr. Allen, would you call the roll, please?
Mr. Carbajal? Ms. Wolf? Ms. Gray? Mr. Lavignino? Ms. Farr?
Here. Would you all please rise with me for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And before we begin public comment, Mr. Allen, you had an announcement, I think, and also then Mr. Alvarez.
Madam Chair, members of the board, I just want to remind the board as well as the public that this meeting is being streamed live at www.countyofsb.org, and that all of the budget documents are also available on our county homepage. There are a couple of links under news and announcements. There's a banner that says budget hearings fiscal year 2012-13, and under that banner there are a couple of links that will take you to the budget book and all of the budget documents that are being considered today. And I'd also like to remind everybody this is also being broadcast live on County of Santa Barbara TV channel 20. Thanks.
Thank you. And Mr. Alvarez.
Yes, good morning, Chair Farr. Just a reminder that we've also made a distribution of updated materials. They are the salmon-colored documents. There's a summary log of the board inquiries that we've completed, along with the actual ones that were completed beyond that. And as a reminder, in the log that's handed out to you, there's a new column added that's the distribution date, so you can see at which date these came out, and these would be the new ones that came out today. And we'll probably have another distribution later this afternoon. There was one additional document, which was the service level impact. It was a very minor change on that. The dollar amount actually remained the same.
Okay, very good. Thank you. And now we'll go into general public comment. Mr. Allen, you have a speaker or two?
Madam Chair, members of the board, we have 3 requests to speak. We'll start with Jeff Bard, to be followed by Andy Caldwell.
Good morning, Madam Chair, members of the board. I just wanted to address the board to thank you for having public comment as open as you do. I think that what distinguishes our democracy is the fact that anybody from any political point of view can come to this microphone and speak their mind. And I want to salute the board for tolerating public comment, which sometimes does cross over the line into personal attack. And I'm astounded at how patient and tolerant the board often is. And public comment, which sometimes is not relevant to what's within the scope of the board's jurisdiction. But I think it's good to have a very loose interpretation of that, because people shouldn't have to go to law school in order to go to public comment. I'm lucky I've had some law school, but going forward, I'm going to thank you in advance for avoiding some of the measures that we've seen with the Los Angeles Board of Supervisors, which really has been quite reprehensible in its attempt to constrain public comment. Well, granted, it's a big, mean city, and you've got some pretty sketchy characters, perhaps, to contend with in a city like Los Angeles. It goes with the territory. But Santa Barbara County is really, not so high density, that we have to take such a defensive posture. So I'm just going to be brief, and if I may encourage other people that may be watching the stream to, get your comments in, certainly on everything and anything. Thank you very much.
Thank you, Mr. Bard.
Our next speaker is Mr. Caldwell, to be followed by Robin Barber.
Madam Chair, members of the board, I'm Andy Caldwell representing CoLab. One of the things I wish that the board would do when they are in a severe financial straits as you are today is take the time and make the effort to list all of the things that you're doing right now that are purely discretionary and not mandated. Because I think you have a mandate from the people to protect public health, safety, and maintain infrastructure. And I know that there's a lot of things that could probably fit under those broad categories. But for instance, one of the biggest threats to the California economy is going to be the implementation of AB 32. AB 32 was signed into law by Schwarzenegger, and the goal of which is to reduce greenhouse gas emissions from California. And the state of California is promulgating rules. There is no mandate that the county come up with a climate action plan. There's eventually going to be mandates that will be passed down, but between the APCD, the Air Pollution Control District, and the various cities, what do you have to regulate? That you would be spending a couple of $100,000 on a non-mandated program. Why not let the APCD do it? Why not let SB-CAG do it? Why not let the cities do it? And or why not just wait for the state to do it? You know, this plan is slated to cost the California economy $180 billion. Jerry Brown thinks he's going to skim $1 billion off in the first year. Where do you think that money comes from? It's going to come from profit and or operating expenses of businesses in the middle of a recession. And the county can't wait to get on that bandwagon, and it's not mandated. So you could hire a couple more cops or a couple more firefighters, you could hire another doctor, or you could pave some streets. There's other things you could be doing right now. You don't need to be ahead of that curve. It's going to catch up with this too fast as it is already. And there's a lot of other things. I've mentioned the smoking cessation program, some of the long-range plans, for instance, the Gaviota Coast Plan, the Children's Health Initiative. None of us want pollution. None of us want sick children. But the fact is there are other ways to address some of these problems without spending your discretionary revenues when you have so little to begin with. You need to take a step back and look at the big picture. Thank you.
Thank you.
Robin Barber will be our final speaker.
Good morning, ladies and gentlemen. Robin Barber representing SEIU Local 620. I wanted to first convey my appreciation personally and on behalf of the members about the thoughtfulness that you've gone through as we go through this process. I particularly want to comment on Supervisor Wolf, and you're taking the lead in talking about not just considering contracting out blanketly and the thought process that you encourage to be put into that. I also want to thank every one of you who encourages your management to go back and convey that your appreciation for the hard work that your employees are doing and the sacrifices that they've made to partner with you in trying to close a budget deficit in times that are very, very difficult and unusual for us all. I also want to make sure that I convey as well, or request of you, if you could encourage your management to look at the impact of what's happening with the budget, the impact to the employees in regards to workload, and mitigating circumstances when it comes to their IDPs or EPRs, their performance evaluations. We tried to make this request during an employee relations meeting to ask that that be a part of it, that it be considered, because so many of them are working way beyond their capacity, and it's really pushing the limits. But the IDPs and the EPRs, those performance standards, are still based on as if they were working 3 years ago, 4 years ago. And there's no real consideration for what that impact is doing with all this additional workload. And that could be mitigated when you're seeing some of these performance evaluations come back and it's indicating that people are below standards. That's because they're overworked. That's because a lot of times they are doing more with less every day. And then last but not least, just to reiterate that a lot of times when there's pressure put on management, that pressure goes down to your employees. And sometimes people are overzealous and they actually display bully boss tactics. We are definitely going to be addressing that as we move forward, because we think that the time is right for that to fester and we want to eliminate it. There's no need for it. We're a partner in this. We all are serving the public. The people that work for you are the public and the taxpayers. They deserve respect at work, and I appreciate your consideration for these suggestions. Thank you this morning.
Thank you, Ms. Barber. All right, that concludes our opening public comment session. And so now we will go ahead and begin our departmental budget presentations, starting first with alcohol, drug, and mental health services. Good morning, Dr. Dietrich.
So Chair Farr and Supervisors, on behalf of Alcohol, Drug, and Mental Health Services, thank you for the opportunity to speak with you today. Joining me are Ms. Christy Toma, our Contracts Manager, and Mr. Michael Evans, our Fiscal Manager. Several of our other senior managers are also here today. To begin, the total recommended operating budget for the department for fiscal year 12-13 is $68.4 million. The capital budget is $105,000. The county's general fund contribution is projected to be $3 million, which represents 4.39% of our total budget. Total budgeted FTEs for the department are projected to be 295.2. In the next few slides, I will summarize the department's most significant accomplishments for the current fiscal year. But before reviewing these slides, I would first like to say how proud I am of the work of our ADMH staff and our community providers who do so much every day to help people of all ages with the challenge of mental illness and substance abuse. So to all our ADMH staff and our provider staff, I say thank you. Now to our key accomplishments. In FY 11-12, the department has continued to enhance our revenue management activities and make real-time operations changes as needed using weekly revenue expense tracking tools. We have also routinely assessed and modified provider rates quarterly for $17 million in mental health contracts to minimize future paybacks to the state. ADMHS is saving $80,000 annually by the consolidation of our Lompoc child and adult clinic locations, and I appreciate the excellent teamwork of our Lompoc staff on this very significant project. We maintained state and federal regulatory compliance at the Psychiatric Health Facility, PUF, through a comprehensive quality assurance program. ADMH has reduced travel costs and increased productivity through video conferencing. The department has leveraged Mental Health Service Act funds to create 30 housing units for approximately 48 individuals and families. We have increased public awareness and access by redesigning our ADMHS website. The department received a CSAC award for our family and peer training program. The department looks forward to conducting our next 2-week family and peer training this August. The department has improved cultural competence efforts through focus groups with bilingual, bicultural clients. These focus groups were initiated by the guidance of our very active Latino Advisory Committee. We have expanded outreach for individuals at risk through our Assertive Community Treatment, Outreach, and Engagement Project. The department has done this by using the existing capacity of 3 Assertive Community Treatment teams, which operate across the county. If a concerned family member is worried that their loved one is at risk due to untreated mental illness, our department can be called, and we will make every effort to reach out to the person to engage them voluntarily in services. And I'm very pleased that the Mental Health Commission and the Sheriff's Department have been very strong and enthusiastic partners in this project. The department has increased co-occurring mental health and substance abuse services through federal grant resources from the Substance Abuse and Mental Health Services Administration. We have increased our capacity to promote alcohol abuse prevention through a state grant that the department was recently awarded. Now I will discuss our proposed fiscal year 12-13 service level impacts. When the department developed its budget a few months ago, we projected a shortfall of $1,096,000 in the core mental health fund. We have described to the board on previous occasions that this shortfall is largely due to the lack of growth in discretionary non-Medi-Cal funding to cover the increasing cost of care for persons without insurance. As a result, ADMHS proposed this initial set of reductions, which are included in the D pages. These initial reductions listed on this page include $217,000 or 32% reduction in core mental health funding to homeless contracts, $496,000 or 38% reduction in out-of-county acute psychiatric inpatient capacity, $181,000 or 19% reduction in out-of-county long-term psychiatric inpatient capacity, and a $203,000 3% reduction in psychiatric health facility costs. Recognizing the significance of the service level impacts, our department has been reviewing options for decreasing these reductions in services. An option that we have decided we can execute is to delay a planned move of 4 FTE information capital technology staff from our MHSA Fund 48 to the Core Fund 44 in the coming fiscal year. Eventually, this will present a funding challenge as the MHSA Capital Information Technology funding stream will end in several years. But for now, by delaying this staff move from 48 to 44, I'm referring to Fund 48 to Fund 44, we will be able to reduce the expected service level impacts by $475,000 for Fund 44 next fiscal year. So the next slide shows both our original proposed service impacts and our current revised impacts. So on the top row, you see that previously, ADMHS proposed a reduction of $217,000 in homeless services. Currently, we are proposing a reduction of $125,000. In out-of-county acute psychiatric inpatient care, under our original plan, ADMHS would have reduced the number of acute psychiatric beds we purchase at Vista Del Mar in Ventura from 5 beds to 3 beds. Now, with the revised impacts, we will be able to purchase 4.2 beds. Long-term psychiatric capacity is also a reduction we are proposing. Initially, we proposed decreasing the number of beds from 16 to 13. Now we are proposing to fund 14 beds. ADMHS will also seek to gain efficiencies at the psychiatric health facility through a reduction of $160,000 in cost. Currently, the PUF has a total cost of approximately $6.4 million, which represents almost 10% of our total ADMHS budget. We look to the consultant work that is being acquired through the county RFP to help determine if there are ways to safely achieve savings in PUF costs. One thing that I would like to add, and I talked with CO Waller about it this morning, is that as we continue to look for remedies to service impacts, we have been considering the possibility that for the homeless reduction, we could use MHSA funding. We're exploring that with County Council. That's probably not something we could get figured out, if you will, until we go through our whole plan update with the Mental Health Commission. However, I have located $84,000 in Fund 44 that I'm prepared to put toward that cut because I am very concerned about the homeless cut. What I would also do then is I would restore the cut to the PUF cost to $203. So in other words, I feel that I do have a remedy for the homeless cut, and I'm happy to talk more about that.
Madam Chair, could you repeat?
Yes, go ahead. Dr. Dietrich, if you would just repeat what you just said about 84,000.
Okay. So in our original service level impacts, we said that we were going to be looking at the possibility of Mental Health Service Act funds being able to be used for these homeless contracts. I've been talking with County Council about that, and there are no supplantation issues, but we would want to look more about the actual activities of those contracts, programs, to make sure they comply with MHSA. We can go forward and do that. Then we do have a process with the Mental Health Commission of every fall they look at an annual plan update that we provide to them and they approve it. So getting MHSA to cover this would take a little more work and approval by the Commission. What I'm saying is that I have another option, which is to take $84,000 that I've located in the Core Fund 44 and reduce the increase the psychiatric health cost reduction back to $203,000. So that saves me about $43,000. So between the 84 and the 40-some thousand from the PUF, I have a $125,000 solution. So I wasn't sure whether we wanted to get into that today, but CEO Waller thought that it would be helpful for me to mention that on that one, we have been very concerned about that cut, and I'm trying very hard to find a way to remedy it.
Okay, so Dr. Dietrich, just to kind of sum up, if you went ahead and made these changes that you're considering, the revised reduction in the psychiatric health facility costs would not happen. So that would stay
Correct.
at the $203,000, the 3%, but the reduction in the core mental health funding to homeless contracts would be eliminated as a service level reduction. Okay.
Chair
thank you.
Farr, that's
Madam-
absolutely correct.
Thank you. Supervisor Lavanino.
Madam Chair, so these are already reflected in our updated, it looks like.
So
No?
a remedy to the $125,000, Chair Farr, Supervisor Lavanino, is not reflected, but I thought that I would bring it up today so you're aware that there's a solution and,
Okay. All right.
okay.
Thank you.
Yes,
All
so,
right.
so the top line there would go away, in effect.
That's correct.
Yeah, the $125,000 cut would be eliminated. But the bottom one for the reduction in the PUF would stay the same at $203,000.
That's correct.
Is that, it's
At
on,
203.
it's on this page, I think, Supervisor Lavanino, that it's probably more up to date than the one that you have there.
Okay.
Supervisor, thank you, Madam Chair. Thank you, Dr. Dietrich, for looking at ways to mitigate some of these impacts, but it would be helpful, I think, for me, because I'm looking at the service level impact chart.
That's right.
Okay, so
So if
just-
you,
go
I'm
ahead.
sorry.
Go ahead. So we
Chair
have,
Farr, Supervisor Wolf, there is a $125,000 cut there for ADMHS in Fund 44 for homeless. And so what I'm saying is that we would be able to take that off the service impact list. And we would return the PUF to the original $203,000.
okay, right now, the PUF, there was a reduction of $160,000.
Right, and I'm saying
And so
I would-
you're saying that you found them?
I would go back to 203, use the balance to help toward the homeless reduction.
Okay, so in essence, we take that off?
Yes.
Our service level impact. And the first two, which was the contract reduction, are those now also taken off? No, actually, excuse me, Supervisor Wolf, what she's proposing possibly is that the reduction in core mental health funding to homeless contracts would not happen.
We've taken off.
Period. The whole thing would be taken off
That's
the
what I'm
list.
saying.
However, the reduction in the psychiatric health facility costs, which were originally at the $203,000, would stay at that $203,000. They would not go down to $160,000. Okay, because that $40,000 difference there would now be used to help eliminate the reduction in the homeless contract. Okay? Okay, so we would
I
still
guess
have...
maybe let's look at it a different way. What are the proposed cuts that you're still looking at?
So what we're looking at is the $216,000 reduction in the acute beds we purchase at Vista. We would now purchase 4.2 beds.
Okay.
In the out-of-county long-term psychiatric capacity, that's for people who go out of county for longer-term care. This would enable us to purchase 14 beds there. And then the last, as Chair Farr says, would go back to $203,000. So I basically would have 3 rows there of proposed reductions still.
All right. Thank you very
Okay.
much. Thank you.
All right.
Okay, go ahead and
Okay,
proceed.
so,
And thank you, Dr.
sorry to
Dietrich,
bog
for
us
that.
down in that. I didn't mean
That's
to do
okay. It's
that.
good to know.
Okay,
Excuse
so
me,
sorry.
I'm
Supervisor
sorry.
Gray?
I'm lost. I mean, I understand what they're saying, but we get this today, so I assume that later on, the county administrator will say, this is what's happening because we haven't had a chance to really, and this is just what I've seen with mental health time after time, you know, come in last minute, whoop, we've got the money, and then we wait through the year and we don't have it. I don't think this is the appropriate time to bring that up, but I'm going to again. I'll wait till comment time.
Thank you. All right, go ahead.
So to the next slide. Looking ahead to fiscal year 13-14, preparing for the future. The proposed DPHS budget assumes no increase in mental health funding. We've been very conservative in our projections for 13-14 on all of our revenue, Medi-Cal as well as MHSA. During that year, we project that we would use the remaining $4 million in MHSA reserves that we have. A budget gap of 4.4 will remain, and that will be due to a $1.9 million increase in salaries and benefits costs, retirement, health benefits, and expiration of wage concessions, $100,000 increase in services and supplies costs, and a $1.5 million decline in available MHSA funds. That's partly attributed to the fact that several MHSA funding streams are time limited and they would be ending. And then a $900,000 decrease in the general fund contribution. As we look beyond to opportunities, we believe that there's reasons for optimism. Again, with the county RFP and consultation, there will be welcome assistance that can help the department build on system improvements. 12-13 state realignment changes are expected to bring more flexibility in the use of funds, and we anticipate possible funding increases. ADMHS believes that healthcare reform will have a benefit for consumers and for department funding. For single adults with mental illness, the impact may be very positive, since now single adults can only receive Medi-Cal benefits if they are determined to be disabled. Under healthcare reform, Medi-Cal services will be available based on income. Persons at 133% of poverty or less will be able to receive some level of health care, including behavioral health care. ADMHS currently spends at least $5 million a year for uninsured persons, but we do not have adequate funding to cover these costs. Under health care reform, it is our understanding that the cost of health care for clients who qualify for benefits will be covered 100% by the federal government for the first 3 years with no local matching dollars required. And that would be a big benefit to the uninsured clients in our department, not only for their mental health care, but for their health care. So that concludes my remarks.
Okay. Thank you, Dr. Dietrich. Any questions for Dr. Dietrich at this time? All right. Do we have public speakers, Mr. Holland?
Madam Chair, I believe we will go through
That's
the
right. We're
rest
going to
of
wait, aren't we?
the rest of the
That's right.
budget units.
You can't get used to this. Okay. We'll go ahead then, and we will go to our next department, which is Child Support Services. Thank you.
Good morning, Madam Chair and members of the Board of Supervisors. I'm Carrie Topliff, Director of the Santa Barbara County Child Support Program. It is an honor to be representing a program that is a role model for the entire world community, available to establish paternity and obtain financial support from both parents for every American child. Second only to the school system in the number of children served, child support enjoys strong bipartisan support and funding that is 2/3 federal and 1/3 state funds. Our annual budget is $9.5 million. There are no county general funds in our program, and the Governor's 2010 proposal to realign child support to county responsibility is not moving forward. We expect our funding to continue to come from state and federal sources. Due to strong political support for the program, child support funding has only gone down once in the past decade. just now with the governor's May revise, a $175,000 decrease. We are very practiced at shrinking our operations and have decreased by 40 staff through attrition and closed our Lompoc branch office as a response to rising costs over the past 10 years. Despite this serious loss in staff, we have been able to increase productivity due to our workload organization and use of new technology. Like every child support department in the country, our performance is assessed by the federal government. We have 5 performance measures, and Santa Barbara made an improvement in and met its goal in each of the 5. We achieved 100% on paternity establishment, 89% in establishment of orders, 59% in collections of current support, 64% in collections on delinquent accounts, collecting and distributing $2.89 for every dollar spent in the program. Of course, that doesn't begin to tell the human stories of the shoes purchased and the lunch boxes filled through our efforts. Of the $27 million in collections, $22.1 million went directly to families, and $4.9 million was used to reimburse the government for welfare assistance made to some of those same families. This year, the entire department created a 5-year strategic plan to help us overcome our funding and staffing limitations with process improvement, training, and top-notch communications, all to further our customer service. We put a scanner on every desk and used a single sign-on technology that permits us to access over 18 different electronic systems without having to remember all those passwords. That's a very nice blend of security and efficiency. We're continually trying to break through the mentality of that's the way it's always been done. We know that nothing stays the same and that change brings constant opportunities for new approaches. To keep that idea front and center, we have a standing process improvement team that's always ready to pounce on the latest brainstorm. The state has been a good partner, developing automated reports to identify cases that have hit glitches, and we've created a special team just to resolve the issues that are identified this way. We are expecting our service levels to remain constant in fiscal year 2012-2013, thanks to the dedication and commitment of our knowledgeable staff. We will continue to probe for process improvements, make technology enhancements, and fine-tune the organizational structure. In fiscal year 2013-2014, we expect to resolve the funding gap that comes from rising costs, as we have in the past, by not filling positions as they become vacant, and by relying on technology, our staff, and increasingly our customers. A successful future requires partnership with our customers, and we are training them in our ever-expanding customer self-service tools and payment methods, as well as using cell phones and outbound dialing to make sure that important communication is communicated timely. We'll continue to bring our best efforts to the needs of the 15,000 families in our caseload, with expected collections and distributions of $28.6 million. Financial security has been identified by the Center for Social Policy as one of the 5 protective factors necessary to keep families strong and children safe. At the Child Support Department, we will continue our commitment to this vital goal. Thank you, and please let me know if I can answer any questions.
Thank you very much for your presentation. Any questions from the board at this time? Any comments?
Thank you.
I guess you gave the board all the information they needed. Thank you so much. All right, we'll go ahead next and hear from Public Health.
Madam Chair, members of the board, good morning. I'm honored to be here before you today to present the fiscal year 2012-2013 proposed budget for the Public Health Department. The Public Health Department mission is to improve the health of our communities by preventing disease, promoting wellness, and ensuring access to needed health care. Our proposed operating budget is $79.6 million, which is reduced from last year's operating budget of $84.1 million. The general fund contribution to public health is about $6.9 million, which is 8% of our budget and represents a decrease of 13% from last year. We're able to absorb this decrease in general fund this year because the difference is being supplanted with one-time realignment funds due to a change in the way realignment revenue is accounted for by Public Health and the Auditor's Office. We are budgeted at 483.3 full-time employees, down from 493.5 last year, and down 81 FTEs, or 14.3% from fiscal year '05. We have a number of key accomplishments over the last fiscal year. We implemented some major technology projects. The electronic health record was our most important initiative. It is already showing positive results, reducing paperwork, increasing efficiency in communication, allowing faster approvals, giving patients clear written summaries of their visits and care instructions. We expect to see improved quality of care, reduce medical errors, and other benefits over time. We initiated electronic prescribing so our providers can electronically send their prescriptions to the pharmacies. It's faster and reduces the chance for errors due to illegible penmanship. We are awarded funding for a patient-centered medical home demonstration project. This is a new model of care that is more comprehensive, accessible, and assigns patients to a personal provider, which allows for better coordination of all aspects of care. It will help our patients become active players in their own health care and improve both the quality and safety of the care we provide. We received grant funding and implemented a diabetes initiative using a team of nutritionists, health educators, pharmacists, and medical providers to get better health outcomes for our diabetic patients. We established disaster medical supply caches across the county so we can better meet local needs in a disaster or emergency. The caches have masks, ventilators, and medical supplies to support alternate care sites that can care for 50 patients for 1 to 2 weeks. We implemented an electronic patient care record for 911 medical responders so they can electronically send patient information to the hospital even before they arrive at the emergency room. We increased animal license sales so more pets who stray can be quickly returned to their owners and to increase rabies vaccination rates. We purchased new equipment for the public health lab, which allows for faster influenza and tuberculosis test results so we can provide timely treatment and control the spread of disease. We set up on-call hours to provide emergency death certificates to accommodate people who practice religions that require burial within a certain time frame. We raised funding and completed the pre-construction phase for the Lompoc Animal Shelter renovation in order to make the facility more customer accessible and friendly, as well as safe for the animals. We initiated a breastfeeding peer counselor program for first-time moms in our Women, Infant, and Children program. The peer counselors use phone calls, text messages, and face-to-face contacts throughout the pregnancy and first year of life to support breastfeeding, which has been proven to have tremendous benefits for both mother and infant. We are awarded National Children's Alliance accreditation for the Sexual Assault Response Team in recognition of the quality services we provide to victims of sexual assault. While we are not proposing service level impacts due to general fund reductions, we are recommending changes for efficiency and business reasons. Implementing our electronic medical record will result in reduced staffing needs. We will save $427,000 by reducing 5.2 positions in medical records and $168,000 from reducing 2 positions in data entry. While our radiology program has provided convenience and high-quality services for patients at our Santa Barbara Healthcare Center, it is no longer cost-effective. In the coming year, we propose to eliminate the program, and the needs of these patients will be met through an agreement with community providers. This will actually provide patients access to an expanded range of radiology services with more affordable fees. This change will save $237,000 and reduce 3 positions. Due to changes in the county's medical and economic environments, we have seen in some areas a decrease in our patient visits and revenue, particularly at our Santa Maria Women's Healthcare Center. In response, we are exploring various options and planning to adjust our practice through service and staffing modifications. No services will be eliminated, but alterations in the practice model and staffing will be considered. Preparing for the future. In addition to providing high-quality public health programs and essential healthcare services, we will focus on a number of key issues and projects for the upcoming year. mitigating our budget gap. We will be watching our expense and revenue trends closely and have developed a budget plan with both short-term and long-term potential actions in order to ensure our fiscal stability. Evaluating the impact of healthcare reform. The Supreme Court ruling expected this month and the elections this November may change the landscape for healthcare reform. If some version of healthcare reform does not go forward, this would create significant challenges for the community and county departments such as public health and ADMHS due to increasing numbers of uninsured patients. If health reform does go forward as currently proposed or in some modified fashion, this will have tremendous impacts across the county for our residents and health system. There will be significant additional workload for DSS with outreach, enrollment, retention, and utilization needs for public insurance programs. ADMHS and Public Health Department will likely see greater numbers of insured patients, which would be a benefit, but we could also be secondarily affected in a negative way if the state responds by reducing funding streams that are currently allocated to counties for indigent care. At this point, the uncertainty makes it difficult to predict the full potential impact, but we will continue to evaluate the opportunities of federal health care reform as they become known so we can respond quickly and appropriately to meet the needs of our patients and the community. While we are looking at reductions in some areas, we are also exploring the possibility of expanding select services in areas of need as part of our patient-centered medical home efforts. This will also make us eligible for additional financial incentives and increased revenue. We will further expand our electronic health record system to provide a way for patients to access their computerized records and to set up remote provider access so that physicians and healthcare partners such as the hospitals can access our electronic patient records and exchange medical information. We look forward to continuing to improve outcomes with our patient-centered medical home demonstration projects. We will continue to increase patient cash collections at the time of service for those able to pay. We will be implementing a fitness promotion and obesity prevention plan to address the fact that over half of Santa Barbara County adults and a third of our youth are classified as overweight or obese. This effort will improve the health of our communities and prevent chronic disease in the future. This initiative will also be coordinated with our own county human resources efforts to develop and implement a wellness program to maintain and improve the health of our workforce. We will complete the renovation of the Lompoc Animal Shelter, which will benefit the public, our staff, and the animals housed there. We will continue our efforts to enhance public health emergency response through a countywide earthquake exercise. This is a very exciting time for us in healthcare with major initiatives that will improve the health of our communities. While we continue to face budgetary challenges, we will maintain our focus on providing high-quality core public health functions and essential services. This concludes our presentation. Thank you, and I'm happy to take any questions.
Thank you so much, Dr. Wada, and to all of your staff and employees. Any questions for public health? Supervisor Gray.
Dr. Gray?
Yeah. Not yet, huh?
I got a promotion.
That's coming.
Great job, Dr. Wada, and thanks for your wonderful response whenever we need anything. Yesterday, at the beginning, when we started talking about the budget overview, it was indicated that there was going to be 87.4 increase in staff, and 44 of that increase in staff was to go to health and public service. Of that 44, how many will you be having in public health, and what are they?
We are actually reducing our number of full-time employees in public health. We're going down from last year's number of 493.5 to our recommended 483.3. So we're actually reducing our number of FTEs in public health.
So that 44, I think Ms. Waller is going to answer me now.
CEO Waller.
Chairwoman, Supervisor, those two departments were our social services and our mental health departments that had increases that were a result of vacancy factors that had been previously budgeted and are no longer budgeted. So we can get that information and send that to you very quickly.
Thank you. The other question has to do with the electronic health records, which is a fabulous idea. I was in Sacramento 2 weeks ago, and one of the things that I attended had to do with the delivery of health benefits and how important it was to access all the possible benefits for the folks that are in our system. For example, SSI. If someone qualifies for SSI, how do we help them make sure that they qualify? And will this electronic recording make it easier so that if I'm a person representing someone that wants to qualify for SSI, can I in fact access that information a bit easier so I can get those benefits?
Sure. Madam Chair, Supervisor Gray, our electronic health record is really for the patient records during the visits to our clinics. And so when someone is applying for SSI or other benefits, they often need a copy of those records as part of the process. And so we do have that in paper form now when we supply copies, but we will now have it electronically and more comprehensively.
So that's a good thing.
Yes.
Very good. Thank you. That's my questions.
Thank you, Supervisor Gray. Any other questions?
Chairwoman, I think Tom has the answer to Supervisor Gray's question, if you'd like that now.
Okay, why don't we go ahead and do that, and then we'll go to Supervisor Carbajal.
Chair Farr, Supervisor Gray, the 44 employee change in the health departments was mental health 14 and DSS 30. And there's actually a summary for the public. There's a summary of staffing in the back of the budget book. It's the very last portion of the budget book.
Supervisor Carbajal.
I just wanted to thank Dr. Wada and his team. Your department's always just so responsive, and I just wanted to recognize that. You guys do a really good job.
Thank you.
Thank you. Supervisor Wolf.
Thank you. Dr. Wada, and your efficiency and business decision impacts. You mentioned the Santa Maria Women's Clinic, and I think we had talked about that at one of our previous meetings because I had expressed some concern about that. I think it was maybe the elimination of a OBGYN, and so the way I'm reading this and from hearing from you just now, it sounds as if there has not been any definitive decision made and that you're looking at the staffing. So is that correct?
Chair Farr, Supervisor Wolf, that is correct. We are not considering eliminating any services. We are considering sort of right-sizing based on the community needs. And we're also looking at other potential services where we may actually expand in Santa Maria. So again, we're looking at different options at this point, and nothing is confirmed.
Okay. And Dr. Watt, on a personal note, I want to express my condolences on the loss of your mother, and I know this has been a difficult time. So thank you for all your work, and while I'm thanking people, I also want to thank Dr. Dietrich for her presentation, and Ms. Topliff as well. Thank you very much.
I will echo those comments. All right. I guess we don't have any other questions at this time. Thank you so much, Dr. Wada, and your team. Now, the next department we will hear from is First Five.
Good morning, Chair Farr and members of the board. It's a pleasure meeting with you today to review our budget, accomplishments in the past year, and goals for the coming years. Joining me today is Wendy Sims-Moten, our Manager of Fiscal and Business Services. In this report, I will be highlighting the accomplishments that have taken place within First Five. Our work is always mirrored by the impact of the economy on families and services that support our youngest residents. This year, we are represented as a department in the Health and Public Assistance Functional Group. Prior to this time, we were represented under general county programs. The total operating budget of First Five is $5.1 million. Of this amount, $3.9 million is from Proposition 10 allocation, and $1.2 million is from additional state and foundation grants and the First Five Strategic Reserve. The amount of grant funding frequently increases during the year due to additional grants being received. There is no general fund contribution, and we have 14 FTEs at First Five. We focus our accomplishments of the First Five staff in 4 areas that are aligned with our strategic plan: funding and leveraging, evaluation and accountability, technical assistance and training, and serving as a convener and partner. Through funding and leveraging, First Five was able to touch 4,800 children, 13,000 parents and other family members, and over 2,000 providers of services for young children through our contracts. Highlighting our accomplishments in 2011-2012, we include the establishment of a dynamic public-private partnership known as Thrive that includes funders, school districts, and key stakeholders addressing school readiness and success in high-need communities. First Five serves as the operational partner for the Thrive Early Years, in addition to being a major funder, and as such administers both First Five dollars and foundation dollars, evaluation oversight, and extensive technical assistance and training. This unique partnership has generated significant collaborative funding, leading to a model program for collective impact. Secondly, we have shown the ability to leverage First Five dollars and the expertise that our staff has to receive local and state grants to improve early care and education in our community. Excuse me. For example, First Five Santa Barbara County was asked by the California Department of Education to be one of 16 counties to implement the federal Race to the Top Early Learning Challenge grant for our state. In addition to grants that we directly administer at First Five, we also frequently serve as a key partner or convener in bringing agencies together to maximize funding success in local and state grants. Through our comprehensive results-based evaluation in partnership with UCSB Graduate School of Education, First Five conducted a comprehensive outcome-based evaluation of all funded programs and started to implement even more effective means to disseminate our results. First Five provides extensive technical assistance and training in many areas of service. A highlight of this is through extensive technical assistance and training. We supported 57 child care centers and 40 family child care homes to improve their quality of care for children, leading to a national accreditation of those sites. It's important to note that as a result of this work over the last 10 years, Santa Barbara County has one of the highest percentages of nationally accredited child care centers in the state, at 21% of the centers accredited, compared to 5% statewide. Additionally, over 250 child care providers increased their education and skills with support of First Five in 2011-12. A major project this year has been in partnership with the American Academy of Pediatrics, the Public Health Department, private physicians, and many public and private organizations to significantly increase developmental screenings throughout the county that leads to early identification of developmental delays and challenges. As we all know, early identification of developmental challenges provides for significantly improved outcomes through early intervention and support. In looking ahead to potential service level impacts, we would like to highlight that we secured 4-year funding through California's Race to the Top Early Learning Challenge grant in the amount of $1.1 million, which will lead to the development of an accessible quality rating scale for child care in our county and increase the number of high-needs children in higher quality care. Once implemented, this system will assist in consistent understanding of levels of quality, which will provide excellent information to parents and increase quality service for providers. The implementation of this process has included extensive coordination with local public and private providers, agencies, and key stakeholders. Implementing this exciting project has led to a significant coordination of staff projects that will lead to positive integration of services within the evolving structure of this project. Since First Five Commission has always recognized that Proposition 10 is a declining revenue source, they have long utilized comprehensive fiscal planning. A major part of that planning was to establish a First Five strategic reserve that is being used to maximize sustainability of key services as revenue decline. That planning process is being implemented as the reserve is decreased through prudent planning, budgeting, and allocations. First Five is monitoring closely the impact of the state budget on many programs affecting young children and their families. First Five staff and agency partners are working hard to appropriately respond and plan for the impact both to providers and to the children and families they serve. In preparing the fiscal years 2012-2014, our First 5 staff will provide additional focus in the following areas in addition to the ongoing work with multiple projects throughout the county. We will continue to build a strong infrastructure to expand and sustain the public-private partnership of Thrive to maximize the exciting initial outcomes we are already seeing in school readiness and success in high-need communities. Through Thrive, we have developed a Children's Thriving Report Card of key indicators including kindergarten readiness, health outcomes, and other recognized benchmarks that will help us truly monitor longitudinally the impact of our projects directed to overall school success. We will expand our work with school districts to better integrate data systems in order to track long-term outcomes for children. We will increase First 5 funded agency knowledge, strategies, and skills to improve quality and access to services. And we will oversee and facilitate a consortia of early care and education providers in implementing Race to the Top in our county. The County of Santa Barbara can be extremely proud of the staff of First 5. The expertise, dedication, and vision that these staff persons possess has led to a significant increase of quality of services throughout our county. Their expertise is widely recognized and utilized throughout the state of California. The work of First 5 and the partnering with public and private organizations has significantly impacted the well-being of young children in our county. Thank you, and I'm happy to take any questions.
Thank you, Ms. Wheatley, for your presentation. Supervisor Carbajal?
Thank you, Madam Chair. Pat, I don't know if people, how aware people are that this is your last budget. You're
And
going to
I'm
be
heartbroken.
You sound heartbroken, but that was a very positive, heartbroken remark. I just want to recognize you for the many years of leadership and service with First 5. I think in great part, much of its success is attributed to your leadership, and I just want to recognize you for it and to tell you that I know you're leaving at the end of this year, but you're going to be sorely missed. And again, your presentation today just reflects the robust accomplishments that First 5, all the commissioners, and that you and your staff have been able to realize, and again, in great part because of your leadership. So I want to recognize you for that and tell you that you're going to be sorely missed. And thank you for doing another great job with this budget.
Thank you, Supervisor. I appreciate your kind comments, but I also want to say that the accomplishments of First 5 truly rests on the staff and the agencies with which we partner. But thank you very much. It's generally appreciated.
Supervisor Lavanino?
Thank you, Madam Chair. Boy, that caught me by surprise. I didn't know that. So congratulations, Pat.
Thank you.
And I just wanted to tell you how impressed I am with the Thrive program, and that I think we're going to get into this later when we're talking about the Human Services Commission and maybe a different way. What I'm most impressed with Thrive is not the scattergun approach of we send a bunch of money all over the place, but that we get focused and we target something, and you've got parameters in place, matrices, so we can test how we're doing, what's working, what isn't working. And I think the money's much better spent that way. And also the way that First 5 goes out and partners with the community. So I think you've got a little model there in Thrive that I'd like to see us use in some other areas where we can get a little bit more, get that rifle approach instead of the shotgun. So I just appreciate that.
Thank you, Supervisor.
Thank you, Supervisor Lavanino. Other comments from the board? I just wanted to thank you for all of your years of service to Santa Barbara County and to the children of Santa Barbara County. And as a supervisor who has 2 Thrive programs in my district, both in Isla Vista and Guadalupe, I've certainly had the opportunity to watch you at work, to see the true collective impact model put into action for the benefit of so many children in Santa Barbara County. So thank you for that. Thank you to your staff and to all the partners. And I think that, again, it's really important to remember that First 5 and Thrive have been out there with this collective impact model first, but it is something that we are looking to in other areas, including to the homeless merger and programs to do with our seniors, and to be able to partner with the nonprofit community with the philanthropic community, which comes in as such an important piece of all of this for funding, is been truly remarkable and a great success. So we know that First Five is going to continue to thrive after you go, but you will be sorely missed. So thank you. And Supervisor Wolf.
Thank you. Well, Pat, for me personally, and I think this whole entire organization, your leadership and knowledge and your passion for early childhood education and community involvement are going to be incredibly missed. I know the times that we've talked, even when I was on the school board, and understanding the importance of not just early childhood education, but the quality of that education. And I think what you talked about our county receiving one of the highest national accreditations in quality is absolutely outstanding. And I want to thank you and your staff for that. I also want to commend you on your association with UCSB and looking at some of the results. I think that goes to what Supervisor Lavagnino said. You know, when you know and understand what you want to target, and using research-based information, I think that's so important. We saw that, I just want to say in general, about our partnership with UCSB. We heard from Probation Department on their partnership. So I think that that's something that it's really good to hear. And, you know, I appreciate that our department heads use that research and value it and implement it. So again, I just want to thank you for your leadership. You have a huge heart, and I know that your work will continue. Thank you.
Thank you, Supervisor.
Supervisor Gray.
I have to add my congratulations. I just can't even imagine children issues without you here. I mean, this is just not possible. And also the many miles you put on going to Sacramento. I mean, you're very well known up there. And that, you know, sometimes that sounds like it's fun.
Well,
really,
as you know, Supervisor.
It really isn't. It's really a lot of work. And I know that we have the Sheriff's Aero Squadron to thank that have facilitated the ability for Santa Barbara County to actually be in line when the money's being handed out in Sacramento, and you've been right there. So congratulations, and just when is this day?
At the end of December, Supervisor, and I'm not leaving the community.
I didn't think that.
Thank you so much. I appreciate all your kind words, and I thank you for your support.
Madam Chair, I just want to remind Pat that for all those executives that trade in a paycheck to volunteer, we always are looking for volunteers.
I was born and raised here, Supervisor, so I don't plan on leaving. Thank you so very much.
Thank you. Thank you again. All right, and now we will proceed to our last departmental presentation under Health and Public Assistance, and that will be from Social Services. Good morning, Ms. Gallagher.
Good morning, Madam Chair. Thank you very much. Madam Chair and Board, good morning. I'm Kathy Gallagher, the Director of the Social Services Department. I have with me this morning Terry Consellos, our Deputy Director, and Victor Zambrano, our Chief Financial Officer. This morning I have the privilege of presenting to you the recommended budget for the Social Services Department, which, as you know, will not become our final budget until after the state concludes their budget. The budget before you retains our current service levels and does not recommend any workforce or service reductions. However, these levels of service continue to be insufficient to meet ongoing demand for assistance and for meeting our audit and performance expectations. Our total operating budget of $142.5 million is essentially unchanged from last year, although the county general fund contribution is about 16% less than in fiscal year 11-12. FTEs are showing a decrease of 10.3 from our fiscal year 11-12 rebudget approved by your board in April. We currently serve over 95,000 individuals monthly. in the Santa Barbara County through our 5 major benefit programs, the CalWorks and Welfare to Work programs, CalFresh, which is formerly food stamps, Medi-Cal, General Relief, and IHSS. And just as a side note, the CalFresh program, this represents a 100% increase in families that we serve since fiscal year 06-07, which was the leading year of the recession. As we look at just a handful of our many accomplishments, I first must commend our staff. Our staff on their wizardry, their magical talents, their supernatural skills in juggling our huge caseloads and increasing demands, and in serving the many demoralized and disheartened people in our community who have had to seek public assistance for the first time in their lives. The tragedies of child abuse and elder abuse have not abated and continue to stretch the limits of our staff's capacity to respond. And as your board is so keenly aware, jobs are still elusive in our county, especially in the North County, and this has challenged our workforce resource centers. In order to continue meeting high demand for our services and to ensure that staff are well trained to properly meet our numerous rules and regulations, we implemented these 2 efficiencies you see here in maximizing the use of technology. Savings in staff time is reinvested into increased productivity. New mandates are never ending in our business. A few of the larger ones are highlighted here. KDA stems from a lawsuit in Los Angeles County that now mandates expanded mental health services in child welfare services for foster children. DSS is reliant on ADMHS to provide these services. AB 12, or the Extended Foster Care Program, now has 25 youth over the age of 18 opting to enroll in the program. By the end of 2012, we expect to add another 15 youth. This is an important and worthwhile program helping foster youth transition successfully into self-sufficiency, but not without significant costs that have not yet been guaranteed by the state under Realignment 2011. In the workforce field, SB 734, passed last year, requires Workforce Investment Act programs to spend at least 25% of their funds on, quote, training. But redefining training, it no longer includes the soft skills that so many job seekers need, such as resume writing, employment counseling, job search, etc. The overall impact is to require a shift of funds from these universal support services, including the mandated one-stop career centers, thus placing our Santa Barbara WRC at risk. Under the new 2011 realignment, child welfare services, foster care, adoptions, and adult protective services are moved to the counties, but not under county control. Mandates are actually increasing as the state moves to further regulate these programs with the justification that they must ensure county compliance with federal requirements. Funding proposed under realignment may not be sufficient to allow us to even meet current service levels in CWS. With all of these new and continuing challenges that I've just mentioned, staffing in our department has remained relatively flat. You can see here that caseload growth has far exceeded the FTEs available to process this work. No additional positions have been added in social services in the past 7 years. This current year, fiscal year 11-12, we were able to increase FTEs, but not positions, with some additional federal and state revenue. As mentioned on slide 1, we are projecting 10 fewer FTEs in fiscal year 12-13, no new added positions, but continued caseload and workload growth. I'm not going to dwell on the state budget proposals here. We've listed just 3 of the major ones. You'll be hearing a report later today from Assistant CEO Nisich on the state budget. Suffice to say that the social services programs are once again the center of the governor's attention. Some of those proposals defy logic, such as the CalWorks proposal. IHSS continues to be targeted with potential serious impacts to our elderly and disabled populations. Negotiations on many of these proposals are in process in Sacramento as we speak, And current information is that some will definitely not survive, but others will. Unknown at this stage are which proposals and in what form will be passed and take effect. As always, our department will be reporting to your board and to the CEO once we know the impacts of the new state budget. This budget before you today is the department recommended but not final budget. Once the state budget is passed, individual county allocations must be distributed within 90 days, which then begins our process to recalculate our entire budget for fiscal year 12-13. We expect to bring this rebudget to your board in January. Preparing for fiscal year 13-14 will be a challenge. Forecasting our ever mercurial revenues from all three sources, federal, state, and local, is always a test of our archery skills. We're always trying to hit the bullseye, but sometimes all we can do is hit the target. What we do project at this time is that the required local match for our programs as they are designed and delivered today will be $25.2 million. The known sources today of local revenue to meet the mandated match will total $21 million, leaving a $4.2 million gap. This budget gap will be generated by two factors. First, increases in expenditures for benefit costs, offset by a small reduction in cash assistance payments and non-labor costs. And secondly, decreases in revenues, most notably a $5.5 million loss due to the depletion of our one-time reserves. In conclusion, we have many challenges ahead, both locally in regards to the county fiscal environment, as well as from multiple federal and state initiatives impacting social service programs and directly impacting our department and staff. One of major importance is worthy of mention here. As you heard Dr. Wada earlier, healthcare reform will have significant impacts if it does move forward. The Act proposes to expand Medi-Cal eligibility to indigent individuals who are at or below the 133% federal poverty level. And DSS will be tasked with determining eligibility, providing ongoing case management, and renewing eligibility annually. Our initial projections estimate that 20,000 residents in our county will become eligible for health coverage under the Medi-Cal program. As a reminder, there is no county cost in the Medi-Cal program. It's all federal and state funding. But the workload impacts and staffing needs will be significant. Our department and our very excellent group of leaders are nothing if not flexible, adroit, and highly skilled. And when need demands, we're able to dance on the head of a pin. But your board should know that the challenges we face ahead to protect the most vulnerable residents of our county while guarding the county's investments in our programs are in sure and capable hands. Finally, I want to say many thanks to the CEO and her staff and to your board for your continuing concern and support for the vulnerable families and children and elderly in our county. Thank you very much, and I'm available for any questions.
Thank you so much, Ms. Gallagher. Supervisor Carbajal and then Supervisor Wolf.
Ms. Gallagher, you know, it seems like this budget I have been dispensing a lot of positive remarks, but I would be remiss if I didn't say the same about you. You know, when we think of the most vulnerable, I know a few departments actually focus on those services, but you just do an extraordinary job. And I'm always in awe of your skill and your insight, and really, really appreciate your leadership.
Thank you very much.
Supervisor Wolf.
Thank you, Madam Chair. So this is we have completed this group.
Yes, and then we're going to go to public comment.
So what I wanted to say, I thought it was interesting that we heard from three departments, social services, public health, and mental health, on the importance of the federal health care reform bill, and the what appears to be an incredibly positive impact that will have on our community for those folks who are uninsured, and also just getting them the services that they need. I was also struck, Ms. Gallagher, when you said that your department serves 95,000 individuals a month. I mean, that's just an astounding number. And and then you show the amount of staffing that you have to work with those folks. I think what that says to me, and you know, with all the other departments, is that we really do need to focus, and I think, you know, you have been drilling this into us, CEO Waller, you know, focusing on those core services. You know, we can expand and look at all these other things, but right now we have such incredible needs in the departments right now that we really do need to focus on. And whether it be your department, mental health, and Dr. Dietrich sitting back there, you know, we have spent so much time up here talking about the availability of beds for the most needy in the community that need psychiatric emergency care. And I know the cuts that are being recommended are nothing that you would want to see. But I have to say that as we're moving forward with these discussions, and we're going to hear from the public today about those mental health beds, I've received some emails that have been so incredibly touching. I'm sure my fellow board members have, where parents have talked about the need to have these beds for their children, or adults after they have recovered have recounted the events that have transpired when they were suffering from a severe mental illness. And I just, you know, these budget hearings are pretty, what is the word? I'm astounded by the work that we do on one hand with our incredible staff. I say, how in the world does this county continue to do such good work? And you know, and we hear it from every department, all of the things that have been done when we have so many challenges. So I just hope, as we move through this, that we look really carefully at some of these service level impacts to not degrade or eliminate some of those really important aspects to serve the mental health community. I know you're not proposing any service level impacts, Ms. Gallagher, but since we did hear from mental health, I just want to make that point, that is one of the, it's kind of a top priority for me as it relates to those needs and the needs of our children. You know, today was kind of a little bit of hearing from our departments about the needs of our children. Even Ms. Topliff, you know, touched on that. And I think we have to really keep that on the forefront of making sure that we care for those youngest, most vulnerable people. Thank you.
And Supervisor Gray, and then Supervisor Lavanino.
Ms. Gallagher, I too thank you. You're remarkable. Remarkable. Workforce investment, what's going on there? You talked about it. Are we losing it? It's so beneficial to Lompoc.
Thank you, Supervisor Gray, through the chair. No, not at all. We're not losing the program. We are having to retool how the money is spent in regard to this new definition of training. It's a little disappointing to us because so many people that we're dealing with today are job ready. They have job experience, but they need some assistance, they need some counseling, they need some encouragement to get back out into the job market. This new requirement is going to cause us to put money into actual training services, which is not a bad thing at all, but it diminishes the amount of money we have left for some of these what we call soft skills. And we are under a mandate to provide these one-stop career centers, which we call in our county workforce resource centers. And those could be at risk. The one here in Santa Barbara is potentially at risk, but we're going to do our utmost to make sure that that doesn't happen.
Okay, thank you. Supervisor Lavanino.
Thank you, Madam Chair. And Kathy, I really do appreciate all the work that you and all of your staff and your frontline people do. When we look at the numbers, it's mind-boggling how they can handle the caseload that they do. And I guess piggybacking on that is, and I've seen CalFresh, you know, we've seen the numbers rise. and I'm driving to work today and I hear a radio ad, and is that the county or is that the state that is telling folks, come on down, everybody, that we're handing out money from CalFresh? Are we part of that, or is that a state commercial?
Thank you, Supervisor Lavagnino, through the chair. No, that is not a county effort. That is a federal and state effort for outreach to families. There's a concern nationally that there's a significant level of food insecurity among the newly poor who may not know that they could qualify for some level of assistance in terms of food benefits. And so they have initiated this nationwide campaign.
Well, thank you again. I do think that, thinking about serving 95,000 people, that's 10% more people than are in one entire supervisorial district. So kind of puts it into perspective, the work that you do. Thank you again so much.
Thank you.
Due to the large volume of public speakers that we have for this section, the board's going to take a 10-minute break now, and then we're going to come back and we're going to start public comment. Thank you.